Let us now learn about femoral triangle. Femoral triangle, it is a subfacial triangular space present on anteromedial aspect of thigh below the inguinal ligament. You can see it is present on anteromedial aspect of the thigh below the inguinal ligament. Boundaries of femoral triangle. Laterally, medial border of sartorius. You can see it is medial border of sartorius. Medially, medial border of adductor longus. Medially, medial border of adductor longus. Base, it is formed by inguinal ligament. Base formed by inguinal ligament. Apex, it is formed by meeting point of medial borders of adductor longus and sartorius. Meeting point of medial border of sartorius and medial border of adductor longus. Laterally medial border of sartorius, medially medial border of adductor longus, base inguinal ligament, apex meeting point of medial border of sartorius and adductor longus. Floor, it is gutter shaped and it is muscular. From lateral to medial side, it is formed by following muscles: iliacus, psoas major tendon, pectineus, and adductor longus. Roof is formed by skin, superficial fascia, deep fascia including cribriform fascia. Skin, superficial fascia, deep fascia including cribriform fascia. Contents of femoral triangle. The main contents of femoral triangle are femoral artery and its branches, femoral vein and its tributaries, femoral nerve and its branches, lateral cutaneous nerve of thigh, deep inguinal lymph nodes. In addition to above structures, it also contains fibrofatty tissue, femoral sheath, femoral branch of genitofemoral nerve. Now let's see each content in detail. Femoral artery. Femoral artery traverses the triangle from the midpoint of its base to the apex. You can see this is base of the femoral triangle. From the midpoint of the base to apex. Femoral artery, as it passes downwards, it passes medially. As a result, near the base of the triangle, femoral artery lies lateral to femoral vein, whereas at the apex it lies anterior to femoral vein. Femoral artery in the femoral triangle gives three superficial branches and three deep branches. Three superficial branches are superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery. You can see three superficial branches here: superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery. Three deep branches are muscular branches: profunda femoris artery, deep external pudendal artery. The deep external pudendal artery, profunda femoris artery, and muscular branches. Femoral vein. Femoral vein lies medial to femoral artery near the base of the triangle. Near the apex of the triangle, it lies posterior to femoral artery. Femoral vein receives great saphenous vein, profunda femoris vein, lateral and medial circumflex femoral veins. Femoral sheath. It encloses upper 3 to 4 centimeters of the femoral vessels. You can see the femoral sheath. It encloses upper 3 to 4 centimeters of the femoral vessels. Femoral nerve. Femoral nerve lies outside the femoral sheath in a groove between iliacus and psoas tendon. You can see this is femoral nerve. It lies outside the femoral sheath. This is femoral sheath. Femoral nerve lies outside the femoral sheath. It lies in a groove between iliacus and psoas tendon. Femoral nerve lies lateral to femoral artery. After passing 2.5 centimeters below the inguinal ligament, femoral nerve divides into anterior and posterior divisions. Between the two divisions, lateral circumflex femoral artery passes. Anterior division, it gives two cutaneous branches: intermediate cutaneous nerve of thigh, medial cutaneous nerve of thigh. Posterior division, it gives one cutaneous branch, saphenous nerve. Lateral cutaneous nerve of thigh, it is a direct branch of lumbar plexus L2 L3. It enters the thigh by passing behind or through the lateral end of inguinal ligament, a centimeter medial to anterior superior iliac spine. You can see here the lateral cutaneous nerve of thigh enters the thigh by passing through the lateral end of the inguinal ligament, a centimeter medial to anterior superior iliac spine. It then divides into anterior and posterior branches. It supplies anterolateral side of the upper thigh. Deep inguinal lymph nodes. They are usually three in number. The lowest one lies below the junction of great saphenous vein and femoral vein. The middle one lies within the femoral canal, Clockett's lymph node or Rosenmuller's lymph node. The highest one lies in the femoral ring. Femoral branch of genitofemoral nerve. It lies in lateral compartment of the femoral sheath along with femoral artery. Now let's revise boundaries of femoral triangle. Laterally, medial border of sartorius. Medially, medial border of adductor longus. For both the lateral and medial boundaries, it is medial border of muscles. Apex, it is formed by meeting point of medial border of sartorius and medial border of adductor longus. Base, it is formed by inguinal ligament. Floor, from lateral to medial, it is formed by iliacus, psoas major tendon, pectineus and adductor longus. Roof, from superficial to deep, it is formed by skin, superficial fascia, deep fascia containing cribriform fascia. Contents of femoral triangle. It contains femoral artery and its branches, femoral vein and its tributaries, femoral nerve and its branches, lateral cutaneous nerve of thigh, deep inguinal lymph nodes. In addition to these structures, it also contains fibrofatty tissue, femoral sheath, femoral branch of genitofemoral nerve.